Gentlemen, I'm Janichi Swope, a men's pelvic floor physiotherapist. This is the story of chronic pelvic pain in men. You're at your desk, shifting every few minutes because there's that same deep, nagging ache between your sit bones again. You've already clocked where the nearest toilets are, just in case the urge hits out of nowhere. You say no to after-work drinks because sitting in a chair for 2 hours sounds like torture. You scroll past sexual jokes in the group chat because lately, even thinking about sex comes with a mix of dread and that what if it hurts again feeling. And somewhere in the back of your mind is that quiet, terrifying question, what if this is cancer and they're missing it? You finally see the doctor. Blood tests, urine tests, maybe an ultrasound, all come back normal. You're told it might be prostatitis, or maybe it's stress, or we don't see anything worrying. You walk out with either antibiotics, painkillers, or nothing, feeling both relief that nothing serious was found and completely lost because the pain is still there. That's the emotional load most guys never talk about. The frustration, shame, and the sense that your body is misbehaving and nobody can give you a straight answer. In the next few minutes, you'll understand a different way of looking at chronic pelvic pain in men. Not as a mysterious problem in just one organ, but as an alarm system around your pelvis that has gotten stuck on high. You'll see why your test can be normal while your pain is very real, and how the pelvic floor, nerves, and brain team up to keep that alarm loud. By the end, you'll have a simple mental model and a clear idea of the next steps that will actually move you forward. Chronic pelvic pain syndrome in men is ongoing pain or discomfort in the pelvic area that lasts for at least 3 months and can't be explained by any active infection, cancer, or an obvious structural disease. It often shows up as pain in the perineum, testicles, penis, lower abdomen, or around the anus, and it can be linked with urinary symptoms and sexual problems. Many men are told they have prostatitis even when there's no clear infection, which is why modern definitions separate chronic pelvic pain syndrome from acute bacterial prostatitis. So when your scans and tests are clear, that doesn't mean that the pain is imaginary, and what you're dealing with is a chronic pain condition that involves how your muscles, nerves, and nervous system are behaving over time. This is why the old, it's just inflammation of the prostate explanation doesn't fit so many men's actual experiences. Think of your pain system like a home alarm. In the beginning, something might have set it off. An infection, an injury, a sudden stress spike, or even a period of overdoing exercise or sitting. Over time though, even after that original trigger has settled, the alarm system can stay extra sensitive, and it starts going off for smaller and smaller things, or sometimes for no obvious reason at all. That is called sensitization. The volume knob on your pain system has been turned up. In men with chronic pelvic pain syndrome, studies show changes, not just locally in the pelvis, like tender pelvic floor muscles, but also in how the central nervous system processes pain signals. That means pain can persist because the alarm wiring has changed, not because new damage is happening every day. The pelvic floor can tighten up as a protective response, breathing patterns can change, and the brain can become hypervigilant about sensations from the bladder, urethra, and the pelvic area. For some men, it's deep aching in the perineum or testicles that gets worse with sitting or after long days, and for others, it's burning with urination, a feeling of there's still something left in the bladder, or constant urges to pee even when the bladder isn't full, because the sensitized system is over-interpreting normal bladder signals. The pelvic floor itself can be overactive, gripping instead of relaxing, which can contribute to pain with or after ejaculation, difficulty with a urine stream, or a sense of tightness or pressure. On top of that, ongoing pain and fear can feed anxiety, low mood, catastrophizing, such as that it'll never get better feeling, and avoidance of sex, exercise, or social situations, which research shows are linked with worse pain interpretation in men. None of this means that the pain is in your head. If the problem is an overprotective alarm system, the goal is not to find one magic spot and fix it. The goal is to turn down the volume across the entire system. That's why guidelines emphasize a multimodal, individualized plan rather than a single pill or a procedure. For many men, that includes pelvic floor physiotherapy to address muscle overactivity and coordination, graded activity to reduce fear of movement, and to work on sleep, stress, and mood so the nervous system is less primed for pain. Urologists and primary care doctors still play a key role, ruling out serious disease, managing any ongoing urological issues, and sometimes using medications for pain modulation or urinary symptoms. But the big shift is this: instead of asking, what's the one thing that's broken, the more helpful question becomes, what are the different contributions in my case? Muscles, nerves, stress, bladder, mood, And how can I address each one of them enough that the alarm system starts to quiet down? If this way of thinking about chronic pelvic pain syndrome makes more sense than that mysterious "why is my prostatitis not going away" story, the next step is to find clinicians who actually work with chronic pelvic pain in men, including pelvic floor physiotherapists and urologists familiar with contemporary chronic pelvic pain frameworks. To start, we want to learn how to decrease pressure in the pelvic floor and surrounding areas, find gentle release techniques, breathing techniques, and stretches that I have covered in other videos. From there, the plan is about gradual change, not overnight fixes, and learning how to calm the pelvic floor and nervous system. For a 5-minute pelvic floor guided stretching routine, click the video over here so you can get started on the journey today. Remember, the key is consistency and working on this every day to change your pain. Thanks for watching.